Hello, and welcome to Nurse on the Run with Patrice and Foster. What if I told you that I found 5 hospitals with little to no nursing shortages? Would you believe me? Yes, no, maybe so? Well, nurses, and my future nurses, you're in for a treat, because I have definitely found 5 hospitals with little to no nursing shortages. It was definitely difficult to envision or even discover one, but we did find one. This hospital has RNs waiting in line. No more burnout, long wait times, blunders, or even safety concerns. More nurses are needed. These states may face a significant shortage of nurses. However, for this video, we will just focus on one jewel with little to no nursing shortage. Globally, health difficulties are evolving and getting more complex as a result of an aging population with chronic disease burdens such as cardiovascular, hypertension, diabetes, and mental health conditions. Along with these developments, which place significant demands on the healthcare systems worldwide, effective workforce strategies that encourage the recruitment, retention, and sustainability of trained nurses are urgently needed to fulfill these increasing demands. The quality and quantity of a robust healthcare workforce is critical to establishing universal health coverage, achieving appropriate population health standards, and fostering equal access to care. Today, we will tell you about the top 5 hospitals with no nurse shortages. Before we begin, go ahead and subscribe. Also, press the bell button to get the latest updates. Without any further ado, let us begin. RNs operate as a part of an interprofessional team to provide health services to people of all ages who are dealing with a variety of health problems. With world health experts such as the World Health Organization projecting an increase in worldwide demand for both health and social care, a health workforce must be of sufficient capacity to satisfy population health needs. Nurses who make up half of the worldwide healthcare workforce play a crucial role in disease prevention and health by delivering treatment in primary, community, and hospital settings, as well as emergency and critical care sectors. A shortage is defined as a discrepancy between the number of nurses required by demand and the number of nurses who will be available to work in the future. In our list of top 5 hospitals with no nurse shortage, at number 5, we have Children's Hospital of Atlanta. In 10 pediatric specialties, Children's Healthcare of Atlanta in Atlanta, Georgia, is nationally ranked. In 1998, Eagleton's Children's Healthcare System and Scottish Rite Children's Medical Center combined to form Children's Healthcare of Atlanta. Hughes Spalding Hospital, Eagleton Hospital, and Scottish Rite Hospital, as well as almost 30 neighborhood facilities around Atlanta, make up Children's Healthcare of Atlanta. For clinical teaching and research, Children's Healthcare of Atlanta collaborates with Emory's University School of Medicine. The two of them run Emory Facility. Children is a pediatric center with over 20 specializations and subspecialties together. Atlanta Children's Hospital is also part of the Emory's Healthcare Network, a network of more than 70 medical specialties spread around the Atlanta metropolitan region. Rare tumors, adrenal diseases, cystic fibrosis, autistic spectrum disorders, and blood disorders such as sickle cell diseases are among the ailments for which this hospital network performs pioneering research and provides top specialist care. The Georgia Congenital Heart Center, which opened in 2014, focuses on the long-term treatment of congenital cardiac illnesses. This center is Georgia's only transitional care program and one of the country's largest, and it is one of the reasons why it has less or no shortage of nurses. Next on the list, at number 4, we have Nevada Regional Medical Center. Hospital for sick high rollers. Just kidding. Nevada Regional Medical Center is a 71-bed acute critical and skilled care hospital in Nevada, Missouri, which has a population of 8,500 people. Nevada Regional Medical Center has acquired a reputation as a respected regional medical center serving a 6-county area since 1937. It is known for its comprehensive healthcare services, experienced and compassionate personnel, state-of-the-art medical technology, and devoted and talented medical staff. Nurses are in limited supply in Nevada hospitals, with several northern Nevada hospitals running out of staff beds for patients. Even before the pandemic, Nevada has had a nursing deficit, as each wave of cases and influx of hospitalizations depressed nurses and led them to abandon the field. Nevada, like other states, is having difficulty attracting traveling nurses to supplement their workforces. However, in Nevada, regional medical center conditions are still better than others for nurses. Coming in at number 3 on our list, we have Palmetto Health / Greenville Health. In November 2017, Palmetto Health and the Greenville Health System merged to establish Prisma Health, South Carolina's largest not-for-profit health provider. The Greenville Health Authority owns healthcare facilities that are leased and operated by Prisma Health as Prisma Health Upstate. A lease with Upstate affiliate organization was made in 2016. Members of the South Carolina General Assembly from Greenville announced in 2021 that they wanted the GHA to supervise and manage the Prisma-run institutions directly, as well as make it apparent that the GHA, not Prisma, has control over the doctors. Prisma Health and LifePoint Health have announced the acquisition of Kershaw Health in Camden, South Carolina, and Providence Health in Columbia, South Carolina, by Prisma Health Midlands. Kershaw Health is a LifePoint Health affiliate with locations in Camden, Elgin, Lugoff, and Kershaw, including a 119-bed medical center and a 20-bed geriatric psychiatric unit in Camden, an outpatient center and urgent care in Elgin, a sleep diagnostic center, and a physical therapy unit in Elgin. Providence Health includes 2 hospitals in Columbia, a standalone emergency room in Fairfield County, as well as numerous physician practices, rehabilitation institutes, sleep centers, imaging and diagnostics labs, and other services. Providence Health's downtown Columbia Hospital specializes in high acuity care, which Providence Health's Northeast Columbia campus recently converted from a specialized facility to a full-service community hospital. Next on the list, coming in at number 2, we have Grady Hospital in Atlanta, Georgia. Grady Memorial Hospital, also known as Grady Hospital or simply Grady, is the city of Atlanta's public hospital. It is the country's 5th largest public hospital and one of the busiest level 1 trauma centers. Because of the historical segregation of its hospital wards, it was also known as the Gradys, a nickname that is still used by elderly Atlanta residents, particularly African Americans. It is the Grady Health System's flagship facility. Grady's net profit was $20 million in February 2013, and the hospital has gained 200 to 300 positions in the previous 18 months. On the list at number 1, we have Hackensack University Medical Center. Saving the best for last. This is so far the best place for nurses and has no nursing shortage. In an industry that considers a 10% national vacancy rate to be a severe shortage, the current U.S. national average for vacant registered nurse positions stand at 11%. In New Jersey, it is 13%, but not at Hackensack University Medical Center, a 635-bed, not-for-profit, tertiary care, teaching and research hospital serving northern New Jersey and New York. Located just 7 miles west of New York City and with more than 63,000 inpatient stays and 1.7 million outpatient visits a year. Hackensack is one of the busiest hospitals in the nation. Nevertheless, at Hackensack University Medical Center, there is a waiting list of nurses who wish to work here. It's worth repeating that statement. There is a waiting list of nurses that want to work at Hackensack University Medical Center. Fiora and her colleague Stephanie Goldberg, RN, MSN, Vice President of Nursing, credit education and mentoring for their success in establishing and maintaining such a strong nursing program. Hackensack's reputation for nursing leadership has piqued the interest of other healthcare organizations across the country, hoping to earn magnet accreditation. That's it for all today, folks. Tell us in the comment section what's your point of view. See you soon with another amazing video.